Hello everyone and welcome to CRAM Search, Clinical Research Appraisal and Methodology for Surgical Trainees, where we pick a paper fresh from the press on a hot general surgical topic, we review it for you, we present it for you, we critique its methodology for you, and provide top-of-the-field expert opinion and teaching on research appraisal and methodology. My name is Gio Perrin, and together with Professors Balasubramanian, Adam Haig, Ben Wood and Josh Lau, we bring you CRAM Search from the wonderful region of the Yorkshire and the Humber.
Lovely. Right. Okay, so we're going to talk about types of clinical research, types of designs. Right. So when we say clinical research, I guess the first question would be, as opposed to what other kind of research? And I thought I should give a very short introduction to research types in general. So there are a number of different ways in which you can classify research. And I've got a few examples of classification systems. And the most elementary is something you probably have all heard of, whereby research is classified into basic and applied research. And essentially, basic research aims to advance knowledge in a particular area, whereas applied research is primarily designed and conducted to address practical problems that people face. With applied research, you have translational on one hand and clinical on the other. Translational research is often referred to as bench to bedside research, or research that takes laboratory findings and makes use of them in the clinic, so lab to clinic research. And I guess that makes sense of what it actually means. Versus clinical research is where you do research on human participants, and looking at the diagnosis, prevention, treatment, and so on of human disease. Okay, so we'll move on to another kind of classification, whereby research is grouped as either qualitative or quantitative. And I guess as the name suggests, qualitative research refers to studies like surveys and studies where you explore behavior, for example, and the researcher often gets immersed in the patients or the environment, if you like, and makes observations on a number of sort of general aspects of the condition they're researching or the patients that they're interested in. And the third type is something that we briefly touched upon last time. We talked about hypothesis testing, and we mentioned about the fact that not all research projects need to have a hypothesis. There could be research which is used to generate hypothesis, and there's research which can be used to test hypothesis. So that's another kind of classification that you can apply to research projects. Okay, so on the right-hand side, I've just got a few examples of the kind of research questions that could be classed into one of these categories. So firstly, you have the question, what causes appendicitis, or what does the appendix do? So that's a very broad, generic question, and that's kind of a question you would answer in basic research. Then you've got a question that says, could appendicectomy influence immune response in patients with ulcerative colitis? I mean, this is the kind of question that you could answer with translational research. So you could be taking blood samples, appendix tissue, and other tissues from patients, look at the immune system, evaluate the immune cells, the kind of proteins they produce, the expression of these proteins, and so on and so forth. So there's a lot of laboratory work involved, and you could apply these results in practice in maybe the management of patients with ulcerative colitis. So that's kind of translational research. If the question is, how do we explore the pathway of care in patients with acute appendicitis? Are we providing patients with a good service? How do we explore the issues involved in the pathway? So that's a good example of qualitative research. Next, if you want to look at a large database of hospital episodes in patients with ulcerative colitis, just to try and figure out aspects of care in these patients and whether these patients have been subject to interventions like appendicectomy. You are essentially exploring a large database without perhaps a fixed or a predetermined hypothesis, and that would be classed as hypothesis generating research. And finally, if after such a database study, you come up with a hypothesis that says, you know what, appendicectomy has the potential to reduce relapse rates in patients with ulcerative colitis, then that's where you have a hypothesis, and you set out to design a study that would then test the hypothesis. So that would be a good example of hypothesis testing research. So, based on this slide, could I ask Adam to explain what categories does today's article fit into, Adam?
Yeah, can you hear me, Simon?
Yeah.
Yeah, so quality of life, you could look at as a qualitative piece of research. However, the tool that was used to measure this gives a single number at the end of the questionnaire, which you could argue becomes quantitative research.
Yeah, agree. And then in terms of basic versus applied, translational versus clinical, this is clearly a clinical project, yeah?
Yeah, absolutely.
Yeah.
And I would say it's applied to address the practical problems.
Yeah. And in terms of the last classification, hypothesis generating versus testing?
So you could generate hypotheses based upon this. You've got a number and you've got models that are generated that test that hypothesis. So I think this is hypothesis testing research. The hypothesis being that there's no difference between patients' quality of life who undergo appendicectomy or antibiotic treatment.
Brilliant. Yeah, I'd agree. So this is hypothesis testing research. Great. Great. You can hear me?
Yep.
Okay.
There's just a little bit of interference on the mic, that's all.
Okay. Is that better?
Yeah.
Yeah, that's better, thanks.
Right. So we'll crack on with the tutorial. So I initially thought I might give a little bit of introduction to what's meant by the scientific method, but I think because of time constraints, we'll probably do it another time. And this is only a very brief sort of mention, but I guess I think we should move on. Right, I'm going to leave that there. The slide will be there, and if anyone is interested, they could just look it up on the website. So now there are two main categories by which you could classify clinical research. The first one at the top in blue is what we call the experimental group or the interventional group, and the other one is the observational group. And essentially, the difference between them is pretty straightforward. In the experimental group, you have an intervention or you do something that would alter the natural history of the disease or the patient. So you've done something active that has potential to change the course of what was due to happen. While in the observational group, you don't do anything active, you simply observe, you simply collect data, ask questions, maybe get samples, blood samples, tissue samples, urine samples, whatever it may be. And then you're looking at different things. You're looking at markers of inflammation, maybe. You're looking at certain interesting tumor markers. You could be doing physical measurements, but you don't do anything that has the potential to interfere with the natural history of the disease. Okay, so those are the two main categories. There is another category of miscellaneous research, which also includes systematic reviews and meta-analysis. Now, systematic reviews and meta-analysis is considered by some people not to be pure research or not to be primary research, and they are sometimes grouped under the category secondary research, with the experimental and interventional categories being primary research. So we're going to be focusing on the experimental and observational categories for the rest of the talk. Right, so experimental research. Now, I'll give you examples in relation to the topic that we've been discussing today, that is appendicectomy. So you've probably heard of single incision laparoscopic surgery, and that's been employed in appendicectomy as well, and there are a few papers on it. So just keep that in your mind in the background. So one type of interventional research is where you have a single arm, one cohort of patients without controls, and where you intervene or conduct an experiment and make some assessment of the outcomes. So you could be introducing cells in your hospital and doing appendicectomy that way, and you're doing that saying there's plenty of other evidence elsewhere that cells is better in one way or the other, and that would be a single arm study. Now, usually in single arm studies, there are controls, and those controls may be hidden. You could have controls from the literature, and you could say that you're comparing your cohort of SILS patients with patients who've undergone laparoscopic adrenalectomy in another hospital maybe, or patients who've been reported in literature to have particular outcomes after laparoscopic appendicectomy. Another way of getting controls would be historical controls, or what we call in epidemiology non-concurrent controls. So those could be patients who had appendicectomy at your hospital before you introduced your SILS approach. So that's one kind of experimental research. The other more common kind of experimental research is the 2 or more arms control trial, where you have an experimental group and then you have a control group. Now, if you ensure that you have randomized your patients, or in other words, randomly allocated every participant that is entering a trial into one of the various treatment groups, then you've performed a randomized control trial. And I think we'll do another tutorial just on randomized control trials, talking about the benefits and also some of the limitations of RCTs. Another group of experimental research studies come under the category of time series, or before and after trials. Now, this is, you're unlikely to encounter this in surgical literature, but this is quite a common design in medical literature, whereby, for example, if you want to look at the effects of certain analgesics on chronic pain, you could subject the same patient to 2 or 3 different pain medications and assess their pain and quality of life after weeks or months of having taken different medications. And the big advantage of this kind of trial is that you have the patient serving as their own control. So there's almost perfect matching if you ensure that other potential design problems are dealt with. For example, you made sure that you've left enough time between the 2 drugs for the effects to be washed out. So you've got the patients as their own controls, and you can evaluate the relative effectiveness of different pain killers on their chronic pain. So like I said, it's not something we encounter in surgical research. Okay, so let's move on to observational research. So we've talked about experimental research or interventional research, and now we're talking about observational research. Now, in most observational research, you need to be looking for the relationship between different variables. Okay, so, and the variables can be classed as one of 2 different types. One is the variables that are associated with or linked to exposure or risk factor. And the other group of variables are variables that are linked to the endpoint. So keep exposure and endpoint in mind. Now, for example, if you're looking at a study that is evaluating the risk of obesity or an infection after appendicectomy, you're looking at obesity being the risk factor and infection being the occurrence of disease. If, for example, you're looking at the relationship between antibiotics as treatment for appendicitis and the outcome of treatment being relapse of appendicitis, then you've got antibiotics as a treatment, which is, in other words, a kind of exposure. And you've got relapse of appendicitis, which is the outcome and which is a kind of endpoint. Okay, so you need to be thinking about what the exposure is and what the endpoint is when you're looking to critique observational research. Now, again, we'll take appendicectomy and ulcerative colitis, if you like, as an example, while we're discussing the types of observational research. Now, the first kind of observational research is so-called case control study. Now, this is a kind of observational study where you're starting off with the endpoint. Now, if you want to look at the relationship between appendicectomy and the development of ulcerative colitis, as an example, you start off with patients who've got ulcerative colitis, and then you've got some healthy controls who've never had ulcerative colitis or who don't have ulcerative colitis. And you look back to see if they've had appendicectomy, or in other words, if they've been exposed to appendicectomy. And then you compare the relationship between the risk factor and the disease, the occurrence of disease. So that's a case control study. I'll talk about it again in a minute. Then the second type of observational research is what we call the cohort study. Here, as opposed to the case control, you're starting with the exposure. So you're starting, using the same example, you're starting with patients who have had appendicectomy and patients who've not had appendicectomy. You followed those patients over time, and that's another key phrase in cohort studies, that you have time as an important element. So you follow these patients over time to see if they've developed ulcerative colitis over the next 5, 10, 15 years, however long you want to design the study for. So that's another type of observational study. A third type is what we call cross-sectional study, where you evaluate both the endpoint and the exposure at the same time, at a particular point in time. So prevalence studies are typically cross-sectional studies. Okay, and again, this is not something you come across very often in surgical research. There are some other unusual types of observational study. I don't think we will discuss that in much detail. I've put them on just for completion's sake. Ecological studies and proportional mortality studies. Like I said, we'll just keep it on the back burner for now. Right. So the most important distinction that we need to make is between these two studies, case control studies and cohort studies. And there's a lot of misunderstanding around these studies, especially amongst people who are new to epidemiology. So I've got this table here, and I'll go through this table. It's fairly sort of intuitive and self-explanatory. So we'll start off with the first row. So in a case control study, you're starting with the endpoint. Like I say, if you're looking at the relationship between appendicectomy and the development of colitis, you're starting off with people with colitis and people without colitis. And then you're looking for the exposure, which is previous appendicectomy. Whereas in a cohort study, you're starting with the exposure, which is have they had an appendicectomy, and then you're looking for the endpoint over a period of time. Okay, so keep that in mind. In cohort study, time is critical. You need to make sure that you've designed the study to allow enough time for the endpoint to occur, because you're starting off with the exposure. So that's the next sort of row. So time period is not relevant in case control studies, whereas it needs to be clear and defined in cohort studies. Now, you might have realized that doing a case control study with this particular scenario as an example is going to be easy to do and cheap, because the exposure has already happened. You've got people who've got ulcerative colitis, and you've got people who are healthy, and then you're just simply looking at the exposure in the past. So it's easy and quick to do. Whereas in a cohort study, you could spend your entire career doing what we call a prospective cohort study. So if you get a cohort of patients with appendicitis who've had appendicectomy and another cohort who haven't, you've got to follow them up for 5, 10, 15 years or longer to see how many get ulcerative colitis in the two groups. So that's the problem with the cohort study. However, the advantages of a cohort study is that there is much less risk of bias. and the opposite is true of a case control study, in that there are significant risks of what we call selection bias. There are a number of different types of selection biases, and again, bias will be another topic, but just keep in mind that case control studies are at a significant risk of bias compared to cohort studies, and therefore not the ideal kind of study if you're going to look at the relationship between risk factor and an outcome and disease. But they're quick and easy to do, and therefore they're often done in the first instance to look at associations before people then embark on a cohort study. Now, case control studies by definition, because you're starting off with the endpoint, are retrospective in nature. Cohort studies, intuitively you would think that they're all prospective, but there's a certain kind of cohort studies that are retrospective. And just to explain this a bit further, using our same example, looking at appendicectomy and the development of ulcerative colitis, if you're doing a retrospective cohort study, what you do is you go back in time. You could go back to the year 2000 and look at all the patients who had appendicectomy in Sheffield, and take another cohort of patients who came into hospital, into the surgical unit for conditions other than appendicitis. And then you followed these cohorts over 20 years up to the current year, say 2020, to see how many developed ulcerative colitis in both groups. And clearly here, you followed patients up over a period of time, i.e. 20 years. You started off with the exposure, i.e. whether they had appendicectomy in the year 2000. And therefore, you have done a cohort study, except that you've gone back in time to identify your cohorts who've had exposure. So that is called a retrospective cohort study. A number of surgical studies that you come across in the literature are retrospective cohort studies. So that's why it's important to understand what it means. And you will find that a retrospective cohort study has the advantages of a case control study in that it is relatively easy and cheap to do, but also preserves the design advantages of a cohort study in that it is less prone to bias when compared to a case control study. Okay, so I hope that hasn't been too confusing, but we'll reiterate this with some examples, and I've got some questions as well at the end, just in case you're wondering. Right, so there are some variants to case control studies, and I've listed three important sort of variants of a typical case control study. I think I'll simply put it up on the screen for you to have a look and see if you can understand what it means, and be more than happy to take questions later on if you did go through the slides and had some questions for me. But I'll leave this for the sake of finishing on time. Okay, so I hope you guys are still here.
Yep,
Right, so shall we start with Gio?
Sure.
Gio, do you want to read this, what you can see on the screen, and tell me what you think of what kind of study this is?
All right. So 100 newly diagnosed breast cancer patients are interviewed to determine dietary histories. An equal number of healthy first-degree relatives, mothers or sisters, are interviewed in a similar manner. We compare the proportion of women reportedly history of high dietary fat consumption in the two groups. So this is a retrospective case control.
Retrospective case control. Well, you don't need to say retrospective when you're saying case control.
Absolutely.
Because case control studies are almost always retrospective.
Yes.
Yeah? Okay, very good. So the first thing to say is, is this interventional or is this observational? It's clearly observational. There's no intervention here. You're not feeding fatty food to people. And the second thing then is to say, what's the starting point? Is the starting point, and you're starting off with exposure, or you're starting off with endpoint. Here you're starting off with the endpoint, i.e. you've got breast cancer patients and you've got some healthy controls. And then you're looking back to see if they've had the exposure. So this is clearly a case control study. Excellent, very good. Right, shall we ask Adam next?
So epidemiologists suspect that a specific viral infection in farm workers is caused by exposure to poultry. Serum samples from healthy poultry workers and from general population are tested to determine the proportion of individuals positive for avian AV antibody. This is blood tests, different groups, and we are observing the proportion of individuals positive. So this is going to be a cross-sectional study.
Yeah, great. Yeah, so it's clearly observational, and there's no disease population here. They simply want to look at the prevalence of a particular protein or antibody in a large cohort of people who may be healthy, who may have had the infection. So, and they're looking at this antibody level at a particular point in time. So it's like a prevalence study, so it is a cross-section study. Great. Okay. Ben, shall we go with you next?
So GP practices across the region were randomly allocated to two groups. One group of practices in which men between 40 and 60 without evidence of coronary heart disease were invited to a treatment group, encouraged to pursue regular exercise, given dietary advice and offered counselling for risk factor avoidance. Another group of practice in which a similar cohort of men were invited for regular medical checks. This served as a control group. Both groups were then followed up for 5 years, and cardiovascular morbidity and survival was compared. So it's a prospective cohort study.
Anyone would like to differ, or did you explain why, Ben? The first question is, is this interventional or observational?
I think it's... Well, in a way, you're providing an intervention by giving them one group exercise, dietary advice, etc., and the other one just for regular checks.
Actively intervening, yeah? So it's got to be an interventional design.
Yeah.
And you have a control group.
Yeah, so it's a control trial, and then you've got this phrase, randomly allocated.
Sure. Yeah, randomized control, yeah.
There'll be a randomized control trial. Now, the thing to keep in mind is, obviously, you'll get a lot more detail when you critique a paper. The methodology will make it clear. Sometimes the title will make it clear. But often, the title and the methodology do not make it clear, and swim studies are frankly misleading. So you obviously need to be able to figure out what the design is, and then we can understand the results and the inferences better. So here you got the phrase random allocation or randomization. So these phrases are giveaways in that if you have such a sort of phrase, then it means it is a randomized control trial. The odd thing about this study is that practices were randomized. So they haven't randomized individual men. They've randomized practices in which the practice that gets allocated to treatment will have a physiotherapist, a dietitian, and a psychologist, and the practices that are allocated to the control arm will not have these additional sort of interventions. And this is a example of what we call a cluster randomized control trial, wherein the unit of randomization is not a patient, but a group of patients. Okay. Right. Shall we do one more and then we'll open up for questions?
Yeah, we have time, yeah.
Is Josh here? No?
Yeah, I'm here.
Josh, I'm sorry, I think you've got the most difficult one. Do you want to have a go at this?
So we compare a driver's use of mobile phone at the estimated time of a car crash with the same driver used during another suitable time period. Because drivers are their own controls, the design controls of for characteristics of the driver that may affect the risk of a crash, but do not change over a short period of time. It is important that risk during control period and crash trips are similar. We compare phone activity during the hazard interval with phone activity during control intervals. Equivalent time during which participants were driving but did not crash in the previous week.
I'm sorry, Josh. You got an awkward one.
So it is a observation study because it did not provide any intervention.
Very good. Okay, so that's where you start. Excellent. Yeah. So the exposure is the use of phone. Yeah.
Use of phone, and then you compare the two endpoints.
Yeah, and the endpoints are the crash.
Yeah.
And you
so
start.
Is that a case control study then? Is that or?
Yeah, correct. Correct. So you're starting off with people who crashed, right? And then you're looking at their own use of phone sometime before. So essentially, it's a case control study. The slight oddity being that the drivers are their own controls.
Yeah, so it's crossover.
Yeah, so it is clearly a case control study because you started off after the endpoint has happened, after the crashes have happened. Okay, and you're looking at previous exposure. Right, great. So this is a case control study with a slight variant. Lovely. Right, let's wrap this up. So we talked about types of research. We haven't really spent much time talking about the scientific method, but that'll be for another time and day. We talked about clinical research designs. So the key, the first categorization is to differentiate research into experimental and observational. We talked a little bit about experimental studies, but we spent some time on observational studies and talked about the differences between case control studies and cohort studies, and what the differences are between case control and cohort studies. Keep in mind that cohort studies could be retrospective cohort studies or prospective. Okay, so we'll end there. Thank you very much.